So usually the signs of a cold are sneezing, coughing, a sore throat, and you might sometimes experience a mild headache as well. So usually with the flu you'll experience fever, chills, sometimes sweating, you'll have a cough, runny nose and a sore throat as well, and it comes on quite suddenly. So usually colds are a lot milder, whereas the flu can cause some more severe symptoms like fever, chills and feeling extremely tired. So yes, with both, you can get sick with both at different points throughout the year, and that's because both are caused through different viruses. Yes, the flu can be really serious for certain groups of people, like babies, those over the age of 65, pregnant people, and those suffering with long-term conditions such as asthma, so they need to be extra careful. So usually the cold and flu season starts at the beginning of autumn, it will peak in winter and ends as we go into spring. Cold and flu symptoms usually spread through tiny droplets that are passed through the air when people cough, sneeze, vomit. It can also be caught from touching things like door handles and surfaces. So cold symptoms can be spread usually within the first few days of symptoms starting. Occasionally you might not have symptoms that are obvious to you, so we would always encourage good hand washing. No, so wet hair does not cause colds, viruses do. However, being cold can weaken your immune system, so it's always good to stay warm. So we would say to wash your hands often, avoid people who you know to be unwell with cough or cold and flu-like symptoms. If you're sneezing or coughing, put your hand over your mouth, and don't put your hand to your mouth if you haven't washed your hands and your hands are visibly dirty. Yes, it's a good idea to get the flu vaccine because the flu virus can change every year, and so the vaccines are updated in line with this. Your GP will be able to advise you if you are eligible to receive the vaccine. So with a cold, we would say to get plenty of rest, drink lots of fluid. You can take over-the-counter medication such as paracetamol to help with pain and any fever. You can also try things like steam and saline sprays as well for a blocked nose. No, so it's not so much that one is better over the other. So paracetamol is really effective for reducing fever and pain. Cough and flu tablets will often include paracetamol, but often things like cough suppressants and decongestants as well. So it's not so much there's a better option, it's what is right for that individual at that time in terms of symptom management. So I would say some are safe, yes, if they contain things like paracetamol, but if you are pregnant, it is always best to check medications with your GP, as they will be able to advise what is absolutely safe and what isn't. Yes, cold and flu tablets will help with a sore throat, particularly if they contain paracetamol and ibuprofen to help from a pain management point of view. You can also try warm drinks and lozenges to help soothe as well. You can, but you do need to be careful. So for example, a lot of cold and flu tablets will contain paracetamol, and it's important to check that, because if you were to then take a standard paracetamol, that would technically be doubling and overdosing. So it's always best to read the labels and check with a pharmacist. Yes, sometimes you can feel a little bit sick with cold and flu tablets. You may also experience some dizziness. If you have any concerning symptoms, we would say to stop taking them and seek some medical assistance from your pharmacist. They don't help cure a cold, but they can help boost your immune system, which will ultimately help you from becoming poorly and unwell. No, flu and colds are caused by viruses, and antibiotics are used to treat bacterial infections, so antibiotics do not work in the treatment of flu and colds. So we would say if your symptoms are mild and above the neck, and what we mean by that is if you had just say a runny nose and a little bit of a cough, then mild exercise might be okay. If you were feeling quite unwell, shortness of breath, then we would say rest is the best thing to do. So we would say to see your GP if symptoms are lasting more than 10 days, you're experiencing difficulty breathing, high fevers that you're unable to control, and you're generally becoming more unwell as opposed to getting better.